Now, it is my pleasure to invite a tireless advocate of the African continent, to her passion, her commitment, but also to the role that she has right now at the UN ECA. I'd like to invite Mrs. Vera Songwe, the Executive Secretary of the UN Economic Commission for Africa. Give her a big round of applause.
Good morning. Your Excellency Minister Hala Zayed of Egypt, Your Excellency the Commissioner for Social Affairs, my sister Amira, Your Excellency my dear sister Halima Dangote, Your Excellency the President of Botswana, President Masisi, Your Excellency my dear brother Michel Sidibe, UNAIDS, Your Excellency, my friend and partner, Akimode, you have to figure it out. Cameroon is beside Nigeria, so we know how to pronounce those names. Your Excellency, the President of Djibouti, and Your Excellency, the Prime Minister of Ethiopia, Prime Minister Abiy Ahmed. Thank you very much for being here this morning. I think, and where's Didier? Come up. Come up. Actually, I wanted you to sit up front, but since you're here, I'd say hello to you. And then go and sit beside Michelle. Thank you. But this is the future of Africa. Okay. The point about the Business Forum is essentially that all of us business people are together, and Didier is doing a lot of work in the health sector. So I think we should recognize him in the work that he's doing. Ike has said a lot about this forum. We started the forum last year precisely because we thought African leaders come to Addis and they talk about a lot of public sector events, and the private sector does not know what is happening, and the private sector doesn't really pay attention to Addis during this time of the year. 2 weeks before that, we have the World Economic Forum, and the private sector does pay attention. So we thought maybe we should do something in Africa where the private sector begins to pay attention to Addis and what is happening, and that our leaders look at the private sector and watch to see also that there is a space in Addis, on the continent, in our union, for the private sector. Last year, we talked about the CFTA, the Continental Free Trade Area Agreement. It is a defining decision for our continent. It is a decision that says we're bringing Africa together. To do that, we have to bring Africa together in many forums. And we decided, as Ike said, to talk about health. For two reasons. One, the outgoing chairperson of the union, President Paul Kagame, also was very interested in the idea of health. And I want to thank my sister, Commissioner Almira, because 2 days ago we had a public sector event on health, talking about how we can fund Gavi, the Global Fund, and all the other health institutions, trying to make sure that the public sector funds health. But we know, as Ike had said, that the public sector cannot fund all of the healthcare needs of our continent. But we also know that the private sector has experience and has been funding healthcare for a long time in many countries. We know that a healthy Africa is a productive Africa. We know that a healthy Africa is a prosperous Africa. So we decided, as we decide to integrate, let's talk about health. Let's talk about health funding, and let's talk about how we can bring the public and the private sector together to ensure that Africa's healthcare is funded, Africa's youth is healthy, and Africa's business is prosperous. That is why we are here today. The idea of the Private Sector Forum, which started in January last year, was really to say that we can join two amazing events that are happening on the continent. And it is no surprise that the leaders that are here today with us are leaders that have signed the CFTA or are in process of ratifying it. Ethiopia, Djibouti, thank you very much. Zambia also, and of course Didier, in the name of Cote d'Ivoire, have all ratified the CFTA. And the CFTA is an amazing decision for the continent. Today on the continent, we import $17.3 billion worth of drugs from outside the continent. $17.3 billion worth of drugs will create about 16 million jobs on our continent if we were to produce them on the continent. That is the purpose of this forum. It is to say we should no longer export our jobs. We can bring those jobs back. Egypt, Cameroon, Kenya, South Africa are all countries that are producing generic drugs for diseases that continue to kill our youth, malaria. We can rid ourselves of malaria if we decided that we could produce affordable drugs on the continent. And I think what the CFTA does is precisely that. It allows us to bring together the expertise that we have on the continent to ensure that we can create the jobs, but as we create the jobs, we can also produce healthy societies. And as we produce healthy societies, we produce prosperous societies. It is a very simple equation, and I think that when you hear us talking about the Continental Free Trade Area Agreement, the private sector is behind it. We are working, of course, with Aliko Dangote in Nigeria to make sure that Nigeria signs the Continental Free Trade Area Agreement. We hope that it will happen soon enough. I must recognize the former coordinating minister of the economy for Nigeria, who is here with us today, this morning. Good morning, Dr. Ngozi. Nice to see you. Thank you very much for being here. I think these are our big economies on the continent, and we are sure that when they join us in the CFTA, we will be a much better economy. We are also launching a report today called Healthcare and Economic Growth in Africa. It is an important report because it looks at what is the private sector doing in healthcare on the continent. The report will tell you that the private sector is in 10 countries on the continent. We are a continent of over 50 countries. So we need more of the private sector, and we need more of the private sector across our continent. We are looking at areas in which the private sector can do well and do good business. The report will show you those areas. And I think what we are doing as the Economic Commission for Africa is ensuring that we can work with our partners, both in the private sector and in the public sector, to define what those spaces are. It is obvious that public-private partnerships have sometimes not produced the results that we need on the continent. However, we have excellent examples. The Minister of Health of Kenya is here. I think Kenya is one of the leading countries that has PPP engagements that are working quite well, where health provision is accessible, affordable to those in the rural areas as it is to those in the urban areas. We are also working with Egypt to look at health insurance, where the public and the private sector can ensure that everyone's health care is taken care of. It is true, health is a public good, health is a social good, but you can do a social good and do good business. And I think that that is what we're here to do today and talk about, is how we can do those things, bring them together and ensure that we have a continent as we emerge into the 21st century that is healthy, that is prosperous, and that will ensure that Africa, as it integrates in a healthy and economically robust way. Ladies and gentlemen, it is my pleasure and my distinct honor to have leaders of the continent with us today to talk about healthcare in their countries and how to attract the private sector. To attract the private sector, we need to create an enabling business environment. We have heard in Ethiopia the decision to improve the doing business index and ensure that the private sector can come. It is opportune that Ethiopia is sitting beside Djibouti. Djibouti was one of the top 10 in the doing business this year. We hope that next year when we sit, and Botswana as well is working to be in the top 10, we hope that next year when we come here, we will have all of you with a business environment that attracts and continues to attract the private sector to come and invest in your economies. Because I think the message here is Africa's economies are open for business. The private sector should continue to invest. But more importantly, the African private sector. I think this is a message to the African private sector that our leaders are expecting you to invest because you do have a good return. And when you invest on the continent, the returns you get are much higher than you will get anywhere else. So take the leap of faith with us at the Economic Commission for Africa, with the African Union, with our African leaders, and especially with the African youth who expect to have a healthy population. Invest in healthcare. The McKinsey report says that health business will be $259 billion by 2030. We know that the first mover advantage is always the better advantage. So we have told you, you have the numbers as the private sector. We're here willing and ready to participate in facilitating your investments, creating a public-private partnership environment that is conducive for you. So please, I think what we're hoping to do after this session and over the course of this year is launch a couple of innovative financing instruments as well, hopefully working with Botswana, working with Ethiopia and with Djibouti to see how we can innovate in the healthcare space, working with Egypt. And if we do that, then next year we will come back to you and give you results of how well we have been able to crowd in private finance into the healthcare sector in Africa. Once again, thank you for coming. A prosperous Africa is a healthy Africa. A healthy Africa is a productive Africa. Please enjoy the rest of your day, and thank you again.
Thank you very much, Vera, for making the case that health may be a social good, but can indeed make sense from a business perspective, but also from an economic perspective. And a healthy Africa is also healthy people, but also an economy that grows with healthy people is important.